Good afternoon and welcome to our Kairos IMS webinar. Give us a couple minutes. We want to let folks into the room and then we'll get started in about 1 or 2 minutes. Thank you all again for joining us. All right. Again, good afternoon, everyone, and welcome to the Kairos IMS webinar on more than a database, CRMs versus case management systems. We're really excited to have you all here today. As we're getting started, if folks want to put in where they're from in the chat, we'd love to hear where folks are coming from and your organization. Just good to see the reach that we have with this webinar. Before I get started, I haven't introduced myself. Again, good afternoon, everyone. My name is Mark Reyes, and I proudly serve as the Senior Vice President of Program Impact at the Urban League of Broward County, based in not sunny today, but cloudy South Florida, Fort Lauderdale, Florida. But hope everyone is doing well across the country who's joining us today. So today we're going to learn a little bit about how to better leverage technology to strengthen our impact, including in particular understanding the difference between CRMs and case management systems, and identifying the tools needed to take our organization to the next level. And before I introduce our guest presenter today, who I'm really excited we have with us, just some quick housekeeping. If you have any questions, please drop them in the chat. The chat and the Q&A are available for you. We'll do our best to get the questions answered during the webinar. If there's something that we can't answer during the webinar, we'll make sure to follow up with you as well. And know that there'll be some polls. And so, we definitely want to ask you to participate in those polls. We want this to be as interactive as we can. So again, I'm really excited to introduce our guest presenter today, Mr. Darrell Booker. Our relationship began through a philanthropic partnership a few years ago, which quickly evolved into a strategic collaboration centered on how organizations like ours can lead at the forefront of technology while solving one of our sector's most common challenges, which is really a lot of our data management and telling our story through our data. From building Microsoft's nonprofit tech acceleration program to shaping global AI learning at GitHub, Mr. Booker has dedicated his career to using technology as a force for equity and impact. Again, we're truly glad to have a brilliant mind like his with us today to guide us through this important conversation. Please join me in welcoming a tech visionary, nonprofit champion, and a cultural connector, Mr. Darrell Booker. Darrell, thank you so much for joining us. Take it away.
Thank you so much, Mark. I need to take you on the road with me. That was a great intro, one of the best I've heard. Thank you so much, sir. And everyone, I am so excited to be here. I'm looking at the chat on my other screen. I see we got folks from Kentucky, Oakland, California, a few people from Oakland. I'm glad you're all here. Yeah, definitely please drop in where you're located, the name of your organization. As Mark mentioned, I've had the pleasure, honestly, of working with hundreds and thousands of nonprofits all across the country and the globe. You all do amazing work. You are the real change makers, providing those vital and human services to people at a hyper local level. And it's very important that people know about you and know the work that you're doing. Every nonprofit, in my opinion, is very unique. You all are providing unique services to unique communities. And I know that you all need as much support and resources as possible. So do not be bashful. Tell us where you're from. I love to get to know different organizations so that you never know, you may get a phone call from me or someone that's in my network and say, hey, we love to work with you all. So I am going to share my screen because Do have a guided presentation. I promise not to bore you by PowerPoints or slides. I want to make this as interactive as possible. I hope you all can see this. But welcome to More Than a Database, CRMs versus Case Management Systems. Really understanding the difference between these tools and why it matters for nonprofits. Once again, my name is Darrell Booker, social impact technology leader. That's a very succinct way of saying it. Just a small bit of background. I have been in tech for 30 plus years, coding at the age of 14, working full time at the age of 18. Built a lot of things as it relates to technology on multiple levels, including enterprise systems, and then pivoted to understand how technology can really support nonprofits. And that began the entire social impact journey for me, whether that was first as a CTO of a nonprofit dedicated to child welfare and the foster care sector, but then into the Microsoft world and big tech that Mark kind of gave you as part of my introduction. So we're gonna dive in. This is interactive, so get your keyboards ready. We want to be able to get some feedback from you all. But I want to know, what tools are you currently using to track your clients or cases? And let's be honest, no one is judging you. I can only see the answers. Your peers can't see it. Are you using spreadsheets, Excel, Google Sheets? We all know we try to leverage those sheets for everything. Are you using some form of a CRM, Salesforce, HubSpot, something along those lines? There's a poll that should pop up. Please drop the answers in the poll. I kind of want to get a taste of what everybody's using. Are you already using a case management system? Apricot, there's definitely other ones, or totally something else. If you're using something that's not even one of these, please drop them in the chat. I want to get a pulse of what's happening and what you all are using. Don't be shy. Let's see what you got. We got some results coming in. Give people another second or so. All right. So, as predicted. Let's see here. 30, the majority. Well, no, no. Okay, it's a tie. So 30% is using spreadsheets. Another 30% is using something else. I would love to know what the something else is. Put it in the chat. I'll try to see it amongst sharing the screen. A few of you all are using case management, and also a few of y'all are using CRMs. Really good background. So you're in the right spot. You're in the right spot to be here for this particular session. So I want to dive in a little bit more why this matters. I told you about the, early career in child welfare. And I literally, you travel the country, saw caseworkers buried in paperwork. And the systems didn't really match their work. Went and actually saw systems in the state of California, for example, has LA has the largest foster care system, and I saw things such as programs that were installed at these agencies that are tracking these most vital cases that were deployed in the early 90s or mid 90s. So actually think about that, using a software that's from the early or mid 90s, something that's extremely old. A lot of these tools, information was going in and it was one way. The agencies, the nonprofits could not even report on the data that they were using. And it just didn't match their work. I knew personally a caseworker who told me that she put her case notes in literally the day before the final day. So I think you go to see a particular client, and within X number of days, I think maybe even 30 days, they had to have the case notes in. And just the nature of the systems, the lack of proficient tools, the fact that it was a lot of paper, it was such a daunting task that she never wanted to do it. And she would wait till that last day to pull all her case notes in. And someone like me kind of looked at that and said to myself, okay, what is the true quality of care here if someone is, relying on putting it in notes based off of memory from 2, 3 weeks ago? Like, are we harming the child that we're serving here? And another example that just really, really stuck out in my mind, San Jose County at an intake center. So when they have to remove a child from a home and they have 24 hours to find a bed for them, I went and I met with her, and she saw I was in tech, and she immediately was like, maybe you can help me. I'm so frustrated. I'm like, What's the problem?" And she's like, I have these list of people that I have to call on paper to see if they have a bed. And then I have this Excel spreadsheet, which is a whole nother list I have to call. And she was so frustrated with the Excel sheet. And I'm like, why are you frustrated with the Excel sheet? And she said, because when I start to scroll down, I cannot see the headers at the top. And I showed her how to lock the header rows, and it blew her mind. She was like, "Oh my God, you just don't know how much time you're saving me, et cetera, et cetera, et cetera, et cetera." And that example sticks to me to this day. I don't think that's an indication of her and her use of Excel. I think it's more of an indication of the lack of purpose-built tools that's for this sector that you all are serving. So this isn't a people problem. It's not a you problem. It's actually a tool problem. So this never left me. I did some great stuff during those time. We held the first ever foster care technology hackathon at the White House under the Obama administration, where we brought child welfare officials and tech officials together for 3 days of hacking, so that one side could see what the other side was doing or what the other side wasn't doing, and it blew everybody's mind. You had child welfare officials saying you could do what on paper, and you had the tech leaders saying you all are still doing what on paper, or you can do what with a computer. But essentially, that was at least for me really trigger something and saying like, hey, there's a huge systematic problem here again with these organizations like you all that are really tasked with providing the most um, vital work to those in our community. So, another poll for you all. Kind of want to see what's going on here and be honest. I think I kind of already know the answer based upon the previous one, but what best describes your situation you're using now? You have the right tools. Your systems match the work that you're doing. Everything is okay. I got a feeling that, or you wouldn't even be here today. You're making it work, lots of workarounds, but we managed, probably a lot of you. And then we're struggling. Our tools just don't fit our needs at all. Would love to see where you all are, in my opinion. Anywhere but we have the right tools is the wrong place to be. Again, this work is so important. When we look at different startup and for-profit apps, they have every tool that they need to be successful. But sometimes a lot of their work isn't even changing lives. It's not human changing behavior. It's making money. Why should organizations like you all that are doing such valuable work do not have the right tools? And the most of you um, saying, okay, you fill gaps. Okay. So most of you are in this, filling gaps. You're pretty much trying to make things work. And honestly, y'all, that's not sustainable. That's how people get burnt out. That's how you have, lots of staff turnover. But more importantly, your clients and who you're serving, are they getting the right care? And again, this is not your problem. It's a system problem. So let's start with the topic of this CRM versus case management. And we saw that some of you all were using CRMs for your work, and some of y'all are just using spreadsheets. And I want to take a moment to even talk about how important it is to have tools that match the actual industry and the work that you're doing. Um, and when we look at a difference between a CRM and a case management, and I witnessed this firsthand too. So this would have been 2016, 2017, somewhere around there. And Salesforce, who is a huge player in the CRM space. Lots of major corporations use it, et cetera. And they were getting into the nonprofit space. And they were kind of walking alongside us as we were doing our work at the nonprofit around the country, working with these children and family services, working with the nonprofit partners. And they were showing up, and it seems as if they were really looking to build a solution that could really service the need. But truth of the matter is, they appear to just take their their standard CRM that corporations use and slap the word nonprofit on it, and in my opinion sort of positioned it as a case management system, but it really wasn't. And unfortunately, for those that don't really know the differences, that really hinders people. So when we look at truly what a CRM is, and for those that don't even know, it stands for relationship manager. It's really about tracking relationships. And typically those relationships are people like your partners, your donors, your supporters. I would even say possibly volunteers, even though you can have a volunteer management system. Um, that's what CRMs are really built for. But when we look at a case management is totally different here. This is about tracking your client's journey. When someone comes into your organization and into your doors, one of the things that you're there to do is to improve their life to some degree. So, in order to improve their life, what do you need to do? You really need to track their journey. That's what a case management is really all about. It's helping you with how you're delivering your programs. All of these clients that are coming in, 9 out of 10 times, you're putting them into some site of structured program. These are the programs that have a finite time. There's requirements, they go to classes, or all the things that may happen with the program, they all look different. But essentially, you're slotting these clients into the program, and then these programs themselves need to have their, or they have their own expectation for impact and output in terms of number of people who've graduated through the program, how many people you're just serving, period, through the program. All of those things are really focused on the program delivery. And then last but not least, really having all of the information needed at your fingertips to really support the client and the particular services they need. So that's a true difference from a CRM and a case management. Two totally different pieces of software have totally different needs. Yes, as a nonprofit, you can be using both, but they should be serving different purposes for you. So let me show you the single most important question each system is designed to answer. So here is the core difference. What does each system answer? CRM is who are your donors and supporters, and how do you engage with them? Hey, donor name is Bob Smith. He started supporting us back in 2015. He's donated this amount of money. He typically likes supporting these campaigns versus these campaigns. Those are all the things that a CRM track. How many times did you email him? How many times did you text him? How has his response be? That is what a CRM does. Now, case management, this is about who you're serving and what services they are receiving and what outcomes are you actually achieving. So, when we think about your work, which of these questions is more important to your day work? And someone may say, no, we care about donors and supporters. Yes, you do. But typically, that's probably one person at the organization. That's probably a fund developer person. Yes, they care about that every day. But as a whole, as a nonprofit that is delivering services to people, it's really on the right. Those are the questions that is most important to you every day. That is the question that is most important to your executive director if you're not the executive director. That is the question that is most important, for the most part, to your board. They also ask about how much money you're getting in. To your funders, they want to know all of those questions, whether that's you're writing the grant application, writing the grant report. these are the questions that you need to be able to answer very quickly and efficiently on a day-to-day basis. And a case management system allows you to do that, not a CRM system. So, another way to think about it, it's just showing my age. It's showing your age too, if you know what a Rolodex is. But a CRM is your organization's Rolodex on steroids. And I'll say I never use a Rolodex. I've seen them. I think by the time I got in the workforce, Rolodexes were done. But it's as you can see, and for those that maybe don't know, that little thing that you used to flip through, and it was actually how you found people's at that time was really phone numbers. I don't even think they was really using email like that. Um, but that's essentially what a Rolodex was, and that's what a CRM is how do I find, or I'm finding, I know a name, let me find them, what's their number, what's their email, or the reason it says Rolodex on steroids, yes, you can add a little bit more information. How did you get to know them? When did you get to know them? Just some of those basic, sometimes demographic or characteristics of um people. And a lot of times is a lot of times your partners, your supporters, your donors. Can it be customers? Yes. But if you have customer or client data in a CRM, it probably should be very limited to the basic information that I mentioned, because you can tap into that to email and things of that sort, but you're not managing their day-to-day client services through a CRM. But a case management on the other story, it's your client's story, chapter by chapter. And when we say chapter by chapter, think about the moment they do intake, whether they're doing intake online, via the web, they're doing intake at a community event, at a table, they come into your office, they're doing intake. That is chapter one. Next chapter is probably putting them into some type of program where you're now delivering service. That particular client can then maybe go into another program or another service. And then throughout all of these kind of chapters and until the end of the book, it's outcome after outcome after outcome. So when you think about a Rolodex, you would not write all of this stuff in a Rolodex. A Rolodex is not built to do all of this. So if we think about the difference between CRM and case management, why are you putting all of this information in a system that is not designed for? And again, it's not your fault. It's I attribute it to marketing folks with a lot of these software solutions that unfortunately just see you all as a customer, a paid customer. And if they can convince you that a CRM works for your work, guess what? They did a great marketing job and they can really care less about the outcome and the real work you're driving. So, I want to also pivot just a little bit because when we think about the information I'm sorry, I actually skipped a slide. My bad, y'all. My bad. Um, some signs that you're using the wrong tool, other than it's probably clicking for a lot of y'all right now, based upon what I said. I kind of hinted towards it earlier. If you're using Excel spreadsheet, you're using a CRM, but these are some really telltale signs. Um, you created workaround fields you can't report on, and that's essentially, you want to get a certain amount of data on or a certain type of data points or things as an output. You can't get it the way it is. So you are creating all types of workarounds. You're putting data in a column or a field that doesn't even match the column name because for whatever reason it reports better on that field than the field that you want, or the field that you want doesn't even exist. It's not even there. You're just basically fitting a round peg into a square hole. That's a really great way to think about or identifying that you're using the wrong tool. Your staff created an entire separate spreadsheet to track cases, and that's basically saying things are disconnected. You have this one thing that, maybe have the basic client data, and then you have another spreadsheet to track the cases, and then another spreadsheet. And essentially, you have data on a single person across multiple spreadsheets. That is a huge sign that you're using things wrong. And reporting takes days to pull things together. That's a telltale sign that you're using the wrong tool. And case notes are buried deep into activity log. So these are kind of four telltale signs that you may be using the wrong system. Any of this sounds familiar? Maybe. And again, it's not your fault. It's not your team fault. It's the system. It's the system that you inherited. But now you know better, and we're gonna get you on the right track. So this is what I was. You have a poll. Want to know what are the things that are frustrating you. Um, is it you can't track progress? You have no visibility into client progress over time. Reporting nightmare. Kind of back to what I was saying. Is it manual? Is it a time-consuming process? Um, is your system too confusing? The staff can't find what they need. They find it too difficult to use. Nobody wants to use it. You can tell that you're not getting the data in it like it's supposed to. That's a huge problem. If you don't have the adoption, then people won't use the tool, or like we said, it just doesn't fit your work. These are some typical frustrations, and it may be a situation some of y'all are experiencing multiple of those. Would love to see what some of y'all's biggest frustration. All right, we got the poll in. Reporting is manual, time-consuming process. That was the biggest, followed by you can't even track progress. I gotta pause here. I got to pause here. And this is why to me, this webinar is so important. The Kairos list system we're going to talk about a little bit later. To me, why it was built and why this is so critical that, for you all to say majorities, you fit into two buckets, that reporting is manual and time consuming. And the one thing is two things. One is it's really hampering y'all from showing your impact when it's time to, like we said, write grant applications or grant reports. If you're not able to quickly get the data that you need, and someone who's set in a role at Microsoft where I provided grants to nonprofits, uh, understanding y'all scale, your impact, being able to look at data is so critical, so critical. Um, the truth of the matter is everybody won't be able to support you just from off of the story and the work that you're doing. In a perfect world, it would. Every nonprofit could get every support that they need because the mission is vital. But the truth of the matter is, data is truly needed to really understand if we especially thinking about funders, they're really looking at, okay, if we have X amount of money to make a difference, where will we have the biggest impact? And they do that by looking at reporting. Uh, the other thing for me is there's a lot of nonprofits that feel like they're having impact because the work feels good. But if you're not able to, and even going back to the first one, if you're not able to track progress efficiently and then to be able to report on it, there's a high possibility that your organization may not be having the impact that you think. And when I say that is, I'm very conscious and make sure you understand what I'm saying. Yes, I know for a fact that you can look at it and say, hey, there are certain individual lives that we are changing. I know them by name. I know their story, and I'm not arguing with you. You're having an amazing impact with those individuals. When I say you may not be having the impact that you want, I'm talking about in terms of if you look at the time that you all are spending doing what you're doing, how you're allocating your resources, and that resources is time, people, and money, you may look back and say, oh, wow, we're not doing this efficiently. There's some things that could be changed. We thought we were having a bigger collective impact, but we're not. And that's what's going to be so critical to be able to use the right tool to track progress and report. So glad you all are here today. I really, really am. Really am. Um, so let's talk about a little bit about the ideal nonprofit tech ecosystem. And again, as someone who has built enterprise solutions, advised a lot of nonprofits, I love working with nonprofits that are brand new because guess what? They don't have any it's a term called technical debt. If you want to write that down and say you learned a new term today, technical debt. And that's basically an organization having so much old tech that doesn't work, doesn't talk to each other, that's outdated. Just like you carry financial debt, you carry tech debt. And that's one of the things that can really hamper an organization by not getting over that debt, no different than personally and financially. It really holds you back. So if you are say, or whether you're a new nonprofit or say you're a new nonprofit that's leveraging tech, you got email, you got a website, you got some basic stuff. But when we look at other tools, you all don't have them. You're actually in a better spot than you think because it's a lot easier to work from the ground up versus some of you that may have some debt that you need to start unraveling, you need to start moving some things. And that's just the reality. I really urge you all to think about putting in this time and effort now to save you time and effort later and have a bigger impact down the road. I know you probably got your annual event coming up, and then you got book bag drives, you got summer camps, you have all these things that you're constantly 365 days a year as a nonprofit. You're running that hamster wheel. We got to get the next thing. We got to get the next thing, next thing. And I kind of urge you to maybe take a step back. There's a term used when building systems called a code freeze. And that's basically saying, hey, we got some bugs in our current application. Don't build any new features. We got to fix this stuff first. I think this is a practice that a lot of nonprofits should consider. Do you said to yourself, hey, let's not run a certain program the last week of this month. Let's spend some time getting our house in order. That really can help you all. So not going to preach on that point anymore, but this is what an ideal tech ecosystem can look like. You have multiple tools that are working together. So we talked about a CRM and a donor CRM and really focus that on your relationship and your fundraising management. Case management. We've talked about how important that is to have your client services and outcomes. Email marketing, entirely different system dedicated to sending out marketing to donors, to your clients, to your funders. So many different people that you have to send emails and communicate with and text. All that can be there. And then you have accounting and HR. I mentioned volunteers, volunteer management can be a separate solution. So each one of these are individual tools that address a different problem. I know what you're thinking. That's a lot of tools, but here's the reality. You're already paying for multiple tools. You're just not using the right one. So how do we get you using the right ones? And really make sure that they're all talking like they're supposed to, and you have the best ecosystem that you can grow into. And as you all take on more customers, more clients, you all get a grant, you all bring on more staff. How do you put yourself in a position to be able to grow and not have what? That technical debt that really hampers you all from being able to move forward. I was just on a call yesterday, and this is a widely known problem, and there are a lot of people that's trying to help you all with you all's tools because they understand if you all don't have the tools, you can't provide the work that's needed. So we just need you all to even kind of do your part and just be aware, like, hey, there has to be a better way. Let's take the time, understand these different tools, and how do we implement them. So that brings me to this important point, and you probably gathered that this is correct based on what I've said. When one system tries to do everything, nothing gets done well. Kind of that saying, when you try to be a expert in anything and everything, you do nothing well. Somebody, well, y'all know what the saying I'm saying. Versus, as a human, you really have your specialty, you have your superpower, you have your thing, and you do that really well and you're great at it. A lot of people fail when they try to do a lot of things. The same thing as it relates to software. So using the right tool for the right jobs. I learned that from my father, who's an electrician. He's always doing stuff. And he always said, if you got the right tools and you're right, you can do the job. And that really stuck with me. Of just having the right tool can really make things so much easier. So um, case management, they're the right tool for you all and the work that you're wanting and needing to do. So what does a real case management system do? Talked about this a little bit briefly. Definitely intake. How are you bringing your customers or your clients into your organization, welcoming them? So being able to effectively intake them, their family. So many of y'all may be providing services um, to the entire family. So how are you effectively in taking and understanding what an entire household looks like? How are you doing initial assessments? Sometimes someone may come into your doors and you may not know, okay, what track are we sending them down yet? Or we may have an idea of one or two. So it's very important to maybe do an assessment to know what services that you're sending them down. Um, Sometimes a lot of your funders may require a pre and a post survey or assessment. So your case management system should be able to do that extremely easy. Um, Service plans, the ability to be able to have individual roadmaps for each person. Everybody is unique. So even though that, yes, you may have multiple people going through one program and getting a set of services, the roadmap is different from each person. What is the outcome needed for Tim versus Sheila? Like there's different outcomes because they're at different stages of their life. Yes, they're in the same program, but what is that roadmap for each? That may be more intensive for one person versus the other. That may be more time for one person or the other. So being able to actually have individual roadmaps. Case notes. We all know how important this is. This is so important. Some of y'all that may be receiving federal funding, you have to have licensed people that are signing off on case notes. This is every interaction that you're having with your clients. Case notes dictate those roadmaps we mentioned. Case notes help to uncover things that you may not know exist. Case notes are important for supervisors. Case notes often are information that's taken to court for judges to read. Case notes are extremely critical. So you should have a system that should allow you to easily capture case notes, the date, the time, how the interaction, and be able to just make sure that you have all of that information at your fingertips. And referrals and outcomes. A lot of you know the term wraparound services. So whether your organization itself provides multiple services and you may need an effective way to be able to even refer someone internally to another program or another department within your organization because you do wraparound services, or you may have a partner organization. You all focus on mental health. You also uncover that client may be having some food insecurities or homelessness, and you need to refer them to a sister organization that's down the street or whatever the case may be. So effectively being able to create those referrals and track those outcomes, this is what a case management system should be doing for you all. Impact and outcome tracking, talked a little bit about this. And I mentioned you need this data to write those grant proposals. So key, so key. I cannot stress this so much to you all. As someone that has been a funder, um, and a lot of times, depending upon, especially if it's a kind of an open grant call, and they may be awarding, say, several organization or a dozen, they kind of giving out grants to a bunch of organizations at one time. When you have those type of open grant calls, it's usually less about um, the exact specifics of your organization and how you're delivering it. They're using rubrics, they're using all types of formulas, and they're literally comparing one organization to another on things such as your scale, how many people you're reaching, your impact, your budgets. Like they're looking at all those factors. It is purely number driven, you all. I think the only time that you may can get away with a really data heavy grant proposal if it's a one-on-one, you maybe have a relationship with a particular corporation or whatever, and you're seeking some money from them, or they may hint that they may give you some money. It seems like there's some existing relationship or fondness of you. You can probably get away with a really qualitative and narrative proposal that just talks about all the great work you do and the partners, and you may can still get that grant. But the majority of them are the other way that I mentioned. It's you up against others. They're using tools, they're using technology, they're using AI to filter through as many proposals as possible. So you need to be able to have the data to be able to back that up. And grant reports is just as equal. I hope you all, I think you all are smart enough to understand that, that creates that next opportunity for you to receive another grant from said funder. So to be able to show them how effective the money they gave you was is vital. And it's not only vital to you all, but I'll say this too, it's vital to the entire ecosystem because as a funder, and as a funder, especially thinking internally, and I've fought internally against maybe some coworkers and came up with this grant program. And there was some naysayers in my organization that said, no, we don't know if that's really needed. We don't know if the people on the west side of Chicago or the west side of Atlanta actually need grants for nonprofits that are supporting uh, homelessness youth or something. I'm making up something. And I convinced them, yes, it is. Yes, it is. Yes, it is. And I go through all of that and I get the money and I get the opportunity to award, say, 10 organizations in each city, right? And one of you all, or two of you all, or multiple of you all, not being able to fill out their report and show the effectiveness of that money, yes, you're hurting yourself, but you're now really hurting the entire ecosystem because now I have to now go to my leadership and they're going to basically be like, yeah, you're right. So what happens? They don't fund anymore. They just won't do it because they're not seeing a return on the impact. So um, that's why it's really important to be able to do that. And without these systems, your team is building a lot of spreadsheets. You're doing a lot of stuff instead of spending your time where it really should be spent, and that's serving the people. Like back to that questions earlier, if you're frustrated and it takes a lot of time, that's time that's taken away from actually having impact with the people. And that shouldn't be how things are. All right, so kind of want to get a post from you all. I think it's our last poll, but based upon this, I love to know where y'all are. When the funder asks for that data, are you able to, in minutes, be able to get them that money? They call you on the phone. They say, "Hey, such, I got to go in this meeting. Can you tell me how many people you served so far this quarter? Can you get them that report in minutes?" Or does it take hours? You got to pull from spreadsheets, emails, and systems, and you got to tell him, all right, I try to get that to you by the end of the day or the morning. Or you're number three, because you already know we don't have this. I have no idea. I'm about to just throw out my best guess. Or is it number four? It's just pure chaos and stress every single time. Where are we? Let's see. Those coming in. Those coming in. I hope there's not too much guessing. Probably a lot of guessing. All right, I'm gonna keep going. Poll hasn't closed yet. I'm gonna keep moving on. Um, okay, it popped in. All right, so most of you all pulling across multiple systems. It's taking a while. Yes, it should not be that way. I said this all the time. You should at any moment be able to pull up your laptop, especially depending on your role, pull up your laptop, pull up a phone, go to a dashboard, go to something and see an instant state of your organization. Not only impact data, but actually the entire state of your organization. If you're using all those tools and using them well and you have them talking, you should be able to, as executive director, understand what your fundraising is look like, what your volunteers are looking like, what your program, your client impact will look like. It should be on the dashboard that you see at any moment. Um, so the problem hasn't gone away. Most nonprofits systems were built for hospitals or adapted from corporate software. I kind of mentioned that when I gave you the Salesforce example. They were not designed for human services organizations. I have no idea. I think one of the things I think it is a lot of people don't see the revenue in building systems for human services organizations. There is one major tech company that I do know, I will not name them, that I remember asking them many years ago, like, hey, why don't y'all build a case management system? And they literally said, we don't think it's profitable for us. Um, so for them, it wasn't, it didn't make sense. And the truth of the matter is, you all need this. So when you have something as a case management system that was built from the heart, from someone who really knows that this is needed, you truly have something that's magical. So um, I want to throw another thing at you real quick, and it's not to confuse you, but just to even show you how there's even levels to case management. Um, and I want to introduce a term called impact management, and that's like the next evolution in nonprofit technology. We talked about case management tracks services, but impact management really tracks those outcomes. You know, and those outcomes is over time with people. Where has that change been? We talk about this work as human changing behavior. So not just track the things that were done, but let's actually track the outcomes and being able to understand that. Go beyond just documenting activity to demonstrating results, and making sure too that what you're doing is aligned to the mission. A lot of case management systems will make sure it's compliant. It's great that it's compliant, but is it also, attaching to you all's mission? That's a next level up, and that's what the Kairos system that some of you all have been hearing about. You've been on past webinars. That's what Kairos is. It's an impact management system. So that next level of technology. So with that, I do want to um, talk a little bit more about Kairos and introducing Kairos. Built for human survey nonprofits by a human service nonprofit. So none of this, big tech company swooping in and seeing you all as just um, a target consumer base to be able to make money. No, this was actually built by peers of you all. And like I said, I had the pleasure of my work at Microsoft to be able to do some early support from various resources and funding to be able to kick this off. For me, myself, again, I'm definitely one of you all. Remember, I was CTO of that nonprofit. So for me, it was really understanding exactly what was needed. And the good folks behind Kairos were in that same situation. So thus you have Kairos IMS, case management system, designed to help organizations do more of what matters, reduce the burden, less administrative overhead for your team. You all are serving people. That's where you should be focused on, not having to deal with paperwork and do a lot of those administrative things. Those are the things that probably make you least excited to come to work. Track outcomes. We talked a lot about that. Coordinating programs, collaboration, seamless collaborations across programs, as well as real-time reporting. This is what the Kairos system does. This is, unfortunately, we don't have time today. It's not the webinar to get a demo or anything, but I did just pull a couple, just a couple screenshots. One, just being able to show you that, even with a quick dashboard, being able to see some instant information right away with number of cases, number of pending completion, where are you against quota, being able to have your full calendar. My calendar is empty, as you can see, y'all. So I must be ahead of all my work because the calendar is empty. But having some of this information right at your fingertips, when we talk about clients, just being able to, do that initial intake, being able to understand the services that they're in from a program standpoint, easily being able to have associated information. We talked about family members. Understanding their self-sufficiency, some of this information that's coming from assessments that I mentioned, various tasks that's associated with said client, action plans. Remember, I told you about personalized roadmaps and journeys for people to be able to have those action plans, and then just the ability to be able to print forms, store documents, all of the things. And this is just a little, more detailed look at being able to apply those case notes for some of you and how you all receive funding, being able to denote whether this is a billable or non-billable unit. All of these things are very important information to be able to capture as a part of cases. So just a couple quick screens as to what Kairos is and how it's intentionally built. Um, Back to some of you all who, first of all, if we know we're using spreadsheets, if you're using a spreadsheet to track this, you have about 100 rows going out to the right. That's the only possible way you can do it in a single spreadsheet, or you have multiple tabs in a sheet, or you have multiple files. That's the only way you can capture this amount of info. If you're using either a CRM or an email marketing system, I know so many people who've turned MailChimp and Constant Contact or tried to turn them into case management systems. So when you're using an email marketing system or CRM to try to do this, you're putting data in fields that don't exist, or you're having to add a bunch of fields. You're just having to do more work to get it to do what you want it to do. And at the end of the day, it still doesn't do it. But Kairos is built for this work, as mentioned. Um, Again, just more things of how it's different, designed specifically for human services, customizable workflows, so the ability to match your organizations to how your organization actually works. And this is so key. Um, I hate to see nonprofits who change how they work based upon the system that they're using. And we all know that's going to cause you not to have a high impact on your work. HIPAA aligned, so we know we have the trust there, and it definitely scales with you. Um, so some things to remember before I wrap this up. Different tools, different purposes. CRM and case management systems are not interchangeable, y'all. They're two totally different things. I hope you really take that away. Each serves a distinct function. Really focus on building your technology ecosystem. Kairos could be definitely or should be a foundational layer as it relates to case management, especially with you all's work. This is probably the most important decision that you will make on the most important piece of software because this is the core of your work and your customers. You can switch out an email marketing system later. You can switch out some of those, but getting the right case management is key from the beginning. And like I said, the future is impact management, and that's what really Kairos is focused on, is moving beyond just basic tracking and then starting to demonstrate what outcomes look like. That's what's going to separate you apart from organization, but also thinking about how holistically you're supporting your community. This is what the future really looks like. So before we get to any questions, if you're ready to transform your mission, your organization, I please urge you to, if you're in front of your computer, get your phone out, scan the QR code. There's also the link, kairosims.com/schedule a guided demo to get a demo. The team is ready to be able to learn more about your organization, learn the pain points, and then be able to show you exactly how Kairos can support. And then you're coming into a family of you. Not only you're joining other organizations that's using Kairos, but again, the great people that's behind Kairos truly, truly care about your work. They're partners in the work that you're doing, and they understand exactly what you're doing. So, with that said, do we have any questions?
Yes,
Uh,
Darrell, we do have a couple of questions. I'm going to
okay.
toss them to you. We do have 5 minutes left on this webinar, so thank you all. And thank you again, Darrell, for that great presentation. So one question is, in your experience, if you can share any real-world examples of when you see a nonprofit choose the wrong system, what happened, and perhaps maybe how did they sort of calibrate and get onto the right system?
It was some of the things that I mentioned. I'm trying to stop sharing my screen too. It's just simply, spending more time fighting with the software than actually using it. That's a real telltale sign. Staff not liking the tool is another telltale sign. And nowadays, I'll tell you the other thing. This was harder, I would say 10, 15 years ago, but now because technology is so prevalent in everyone's personal life, when you start to make the correlation like, how come when I'm doing stuff personally at home, I can use systems and things work and I can track my kids' stuff and I can when that starts to click in your head that you're more productive at home than work, that's another telltale sign. So I would say one, recognizing that. I would say number two, quickly making the decision that, hey, we need to find something else. And then three, when you find something else like a Kairos, just please not be afraid of the work that's ahead. Like, again, some of you all have technical debt that is not Kairos' fault. It's not anybody's fault. It's not even your fault. And it just may take some time to unwind some of the things you have. You probably have some bad processes and workflows because of that software, and really taking the time and saying, okay, how do I now adapt to this? It's kind of like when you get a new house. You get a new house, you say, you know what, we're in a new space. How do we now live better in this house, not necessarily focus on where we were living before?
Awesome. You sort of touched on some other questions around the sort of challenges that organizations may face in integrating or moving on to a new system. We talked about sort of advancements already. What about the role of AI in these systems?
The role of AI is very critical, and it's something that's we're scratching the surface. But here's the thing: I want to make sure y'all understand what AI. AI is only good with the information that's put in. So, a lot of people are trying to skip to, oh, we want to use AI, but when we think about your house and your foundation, you don't have the right data structure to even support AI being efficient. So you have to start there first. You have to be in a situation that you're owning your own data. You're not putting everything in the funder system. They have all these requirements. So you put in all the things in the funder system, and you don't really have anything in your system. You need to stop that. You need to have something like a Kairos where you own every piece of your client information first. It's in there. It's in the way that you want it. It's using the terminology that you want it. There's no assumption. So when you tap into an AI system that's now reading that data, it can do the interpretation, the analysis, all the things that we love with AI, but it's using it off of really good inputted data.
Awesome. Thank you so much, Darrell. We are at time, so I appreciate again you, Darrell, for spending your hour with us here, Kairos IMS. Again, appreciate all your engagement in the development of Kairos IMS and being a great supporter of ambassador. What a great presentation. I hope everyone who joined us today, was able to get a lot of information on again making that selection between that CM case management
CRM.
system. And the client management system, the differences between all of those, the CRM and the CMS. And again, for those who are interested in learning more about Kairos, make sure that you can book a call with us. Our staff will get back to you, and we'd love to show you a little bit about Kairos and talk you through and see some of your pain points and how Kairos may be a solution for you. So definitely, there's a link in the chat, and I think we also have the QR code on the presentation. You can also visit our website at kairosims.com, and there's links there and more information all about Kairos. So until our next webinar, thank you all so much. Definitely look out for our next webinar. We would love to have you on there, and you can keep learning more, and we can keep sharing more information about how we can do better in the nonprofit sector so that we can show impact to our community. All right, y'all. Thank you all so much. Darrell, again, thank you so much. Have a wonderful day, great afternoon. Happy Wednesday, everyone. Take
Bye,
care.
everyone.